It's a pleasure to be with you. The title of this session is Environmental Public Health Practice, Part 4, Policy and Regulation. There are no disclosures for this presentation. Objectives include discuss key environmental policy principles, review key sources of policy information, review basic concepts of advocacy and lobbying, review the federal policy-making process, review the key United States regulatory agencies, review major United States environmental laws. Over the past 2 centuries, many public health policies, regulations, and laws to mitigate environmental problems have been implemented, but much more needs to be addressed to adequately protect the public from environmental health threats. A short list of environmental health problems to be solved includes lead poisoning, environmental impacts on genetic diseases, toxic contamination of food and water, ground level ozone, climate change, toxic waste, disparate impacts of environmental problems, etc. Environmental policy takes place within a political context. Politics is defined as the activities associated with governance and often aligned with a set of beliefs or principles. Politics occasionally conflicts with environmental science, resulting in policies not justified scientifically. For example, research demonstrates that logging of the nation's forests contribute to increased greenhouse gases and climate change, supporting the concept of policies that limit logging. Those policies may be resisted by the public and policymakers, since it could increase unemployment in communities reliant on the logging industry. Another example would be when science demonstrates that low levels of water pollutants are not associated with adverse health effects. Yet politicians and the public demand that those pollutants be completely removed, even at great expense to the government. Let's begin by considering the definition and some key attributes of policy. Policy is generally adopted by a governance body within an organization. Many organizations develop policies, including local, state, and the federal governments, private businesses like insurance companies, schools, faith-based and other nonprofit organizations, etc. For this session, we will focus on government organizations and particularly the federal government system, since government is a key player in the development of most policies that impact the health and wellness of populations. Policy is a statement of intent, an authoritative decision by a governance body or group that has the power to implement that intent and decision. Policy defines a deliberate system that directs or influences the actions, behaviors, and decisions of others. Policy is implemented through rules, regulations, procedures, and protocols and must be enforced to be effective. This session will deal specifically with the development of public policies that reach beyond the individual to the general population. It's important to recognize that public policy problems are not addressed only by government interventions. A good example of that would be the occasional influenza vaccine shortages experienced in the United States. Historical responses included government policies to encourage public research capacities and provide production incentives like tax cuts and subsidies. Other solutions relied on private company policies, including decisions to increase investment in private research, development of more efficient vaccine production processes, building new plants to enhance production capacity, etc. These private company policies were adopted to increase company profits, but also at the same time played a central role in solving influenza vaccine shortage problems. Government and private policies working in a coordinated way are often necessary to solve complex public health problems. Environmental policy is defined as a statement by an organization of its intentions and principles in relation to its overall environmental performance, providing a framework for action and setting environmental goals. The National Environmental Policy is well stated in the Environmental Policy Act of 1969, which states that the Congress, recognizing the profound impact of man's activity on the interrelations of all components of the natural environment, declares that it is the continuing policy of the federal government, in cooperation with state and local governments and other concerned public and private organizations, to use all practicable means and measures, including financial and technical assistance, to create and maintain conditions under which man and nature can exist in productive harmony and fulfill the social, economic, and other requirements of present and future generations of Americans. There are 4 guiding principles for the development of environmental policy: the precautionary principle, environmental justice, environmental sustainability, and the polluter pays principle. The precautionary principle states that preventive, anticipatory measures should be taken when an activity raises threats of harm to the environment, wildlife, or human health, even if some cause and effect relationships are not fully established. Environmental justice means that all people, irrespective of their race, country of origin, and socioeconomic status, should be treated equally. Environmental sustainability means that a strong, just, and wealthy society can be consistent with a clean environment, healthy ecosystems, and a beautiful planet. According to the Organization for Economic Cooperation and Development, OECD countries, in 1974, of which the United States is a member, the polluter pays principle means that the polluter should bear the expenses of carrying out the pollution prevention and control measures introduced by public authorities in member countries to ensure that the environment is in an acceptable state, which relates to several pollution sources, including accidental toxic releases. The OECD also recommended that the costs of controlling pollution be incorporated into the price of goods and services provided by manufacturers. Key sources of information that can be used to inform policy development includes risk, environmental impact, and health impact assessments. Risk assessments determine health risks associated with environmental and other hazards, balancing economic and other costs with health and societal benefits that may accrue through various policy options. Adopting new environmental policies may require the expenditure of considerable public and private funds that may have negative economic impacts. For example, in the United States, The economic cost of switching from leaded to unleaded gasoline was significant, but the risk assessment demonstrated numerous health benefits that justified the economic cost of that policy decision. An environmental impact assessment, EIA, reviews the potential environmental impact of implementing a specific policy or project. An example would be an EIA of a proposed residential development project and its impact on air and water quality in the area. A health impact assessment, HIA, estimates the population health effects of a proposed project. An example of an HIA would be the assessment of the impact of a proposed reservoir project and its health impact associated with increases in mosquito habitat and vector-borne diseases. Influencing policymakers is important, but also a challenge. So let's spend a few minutes discussing policy advocacy and lobbying by considering key concepts from Marcia Avner's book, The Lobbying and Advocacy Handbook for Nonprofit Organizations. The definition of advocacy is to actively promote a cause or principle involving actions that will lead to a goal. Lobbying is a special form of advocacy to influence legislation or laws that are formal statements of public policy. During this session, I will use the term advocacy to mean both advocacy and lobbying. So why should public health advocate for anything? Avner lists several reasons for advocacy, including people working together make a difference in changing laws and policies. Advocacy is a democratic tradition. Advocacy helps societies find real solutions. Policymakers need the input of advocates to make good policy decisions. Advocacy gives organizations and the public a voice. This slide lists some key attributes of advocacy. As in the previous definition, advocacy actively promotes a cause or principle. It involves actions that lead to a goal. Policy advocacy is one strategy to help reach health and wellness goals. Advocacy groups are generally organized to address focused issues and have a limited but significant role in influencing the decisions of policymakers. Advocacy groups make the case for their constituents before government, plying the halls of Congress, the executive branch, the courts, and the offices of other interest groups to provide a linkage between citizens and government. This slide lists a few key advocacy concepts. Seek to influence policy throughout the policy-making continuum. A multi-channel approach is usually more effective than just focusing on one area of that continuum. Complete research to support policy recommendations. This may require collaborating with academic centers or other partners that have research skills and access to relevant data sources. Gain and maintain access to decision makers. This underlines the importance of spending adequate time to develop relationships and trust. Strong relationships and trust provide a solid base to weather the inevitable conflict associated with challenging and contentious policy issues. Develop persuasive arguments that are designed specifically to resonate with the intended recipients. To do this, advocates must fully understand the culture, perceived needs, and expectations of those recipients. Develop a detailed advocacy strategic plan that includes grassroots campaigns that encourage interested individuals from the general public to contact key political leaders and influencers. Grass tops strategies that seek to engage various leaders of communities, other organizations, etc., to advocate for policies. Organize coalitions, since numbers speak to leaders. Develop media strategies that effectively transfer not just messages, but appropriate meanings to target audiences. Advocacy strategies may also include providing funding for political candidates who are supportive of desired policies. Let's consider advocacy and activism. As previously mentioned, advocacy refers to the act or process of supporting a cause or principle. Advocacy can be confrontational or non-confrontational. Both types of advocacy are important, but must be used wisely, dependent on the situation at hand. The main point of advocacy is that it is supportive of a cause. In my experience, effective advocacy is often subtle, quiet, and behind the scenes. Activism is often synonymous with confrontational advocacy and is generally visible and in your face. Sometimes activism is counterproductive, undermining the ultimate accomplishment of a goal. It's always important to ask the question, will the action chosen, confrontational or non-confrontational advocacy, potentially win a battle but ultimately lose the war? It takes good judgment to determine which type of advocacy will be most effective to reach the goal. Identifying appropriate arenas of influence is a major part of an advocacy plan. Where do you need to focus resources and activities to obtain the goal? There are generally 3 arenas of influence for public health policy work: legislative bodies, administrative branches, and courts. The most effective way to influence public policy is through advocacy of the legislative body. This is particularly true when trying to influence funding or appropriation priorities. The legislative arena is where broad policies are developed that impact policies like workplace safety, social behaviors, violations of standards, etc. The executive or administrative branch can occasionally influence policy through executive action or orders. Agency directors have some latitude to establish rules to solve problems. If issues can be addressed through executive orders or agency rules, this avenue should be pursued, since it is often an easier venue than through the legislative process. Complex issues are usually settled in the courts. Litigation is necessary when legislative bodies have no authority or refuse to act, when federal, state, and local decisions are contradictory, and when there is reason to believe that laws have been violated. In democracies, advocate groups are an indispensable part of the policymaking process, providing a voice for the public. Let's now consider the federal policymaking process and a few key advocacy opportunities. Article 1 of the Constitution states that Congress is the national lawmaking body and is granted all legislative powers and the right to enact necessary and proper laws. In the United States, there are 2 chambers of Congress, the Senate and the House of Representatives, known simply as the House. Both the Senate and the House develop legislation to levy taxes, collect revenue, pay debts, provide for the general welfare, regulate interstate and foreign commerce, establish lower federal courts, and declare war. The Senate, in addition to the above, ratifies treaties and confirms public officials nominated by the President. The Senate has 100 members, 2 from each state. Senators are elected for 6-year terms and must be at least 30 years old, have been a United States citizen for at least 9 years, and be a resident of the state they represent. The House of Representatives has 435 members. They are elected from congressional districts defined by population. Therefore, more populous states have more representatives. Each congressional district represents approximately 710,000 people. For example, in 2020, North Dakota has 1 representative, where California currently has 53. House members have 2-year terms. 2-year terms often translates into members focusing more on short-term issues that will impact their re-election. Representatives are commonly in a perpetual campaign mode. Representatives must be at least 25 years old, a U.S. citizen for at least 7 years, and a resident of the state they represent. Due to the 6-year terms of senators versus 2-year terms of members of the House, senators are generally more concerned with longer-term policy issues than members of the House. This is important to consider when developing policy advocacy strategies. The Vice President presides over the Senate. In the Vice President's absence, the President pro tem presides, though this is generally a ceremonial position. The Vice President can vote to break a tie. The Senate has majority and minority leaders and majority and minority whips who are selected by their respective parties. The majority and minority leaders speak on behalf of their party. The majority leader assigns bills to committees and schedules Senate floor action of bills. Both the majority and minority leaders work on committees, direct strategies, and seek to keep their respective parties unified. The majority leader may block bills by not scheduling them for consideration by the Senate. The minority leader is not able to schedule floor action and bills, since that is the role of the majority leader only. The majority and minority whips track legislation, mobilize support for leadership positions, keep track of how members will vote, and assist the majority and minority leaders in accomplishing their party's strategy. The Speaker of the House presides over the House of Representatives. The Speaker of the House is elected by House members by a simple majority vote. This generally means that the Speaker will be a member of the majority party. After a candidate is elected, they are sworn in by the Dean of the House, who is the longest-serving member of that body. The Speaker assumes the position of President of the United States in the absence of a President and Vice President. The Speaker's duties include prioritizing and scheduling bills, assigning bills to committees, naming members of joint and conference committees, etc. As with the Senate Majority Leader, the Speaker of the House can block bills by not scheduling them. The House also has majority and minority leaders and majority and minority whips selected by their respective parties. The House Majority Leader does not preside over the House, since that is the job of the Speaker. The House Majority Leader works with the Speaker to coordinate party strategies and the legislative schedule. The House Minority Leader and majority and minority whips function like those in the Senate. Let's now consider Senate and House committees for a few minutes. Committees are considered the workhorses of Congress. This is where key decisions on bills are made. Committee activities include hold hearings, coordinate with other branches and constituent groups, including the president, the administration, and various lobbyists. They draft legislation and amendments, educate congressional members on bill details, introduce and discuss committee bills on the floor, influence House members for support, provide oversight of the executive branch, etc. Committee work provides an excellent opportunity for policy advocacy work and influence. Standing committees in the Senate and House are generally permanent committees. There are currently 20 standing committees in the House and 21 in the Senate. Some key functions of committees include authorization and appropriations functions. Authorization means that a committee may create or authorize programs or agencies. Appropriation provides the committee with authority to approve funding. As expected, the most powerful and popular committees are those with appropriating authority. Policies must be appropriately funded to be effective. This slide provides a list of key appropriating committees in the Senate and House. These are important committees to engage in advocacy efforts. The House Ways and Means and Senate Finance Committees have jurisdiction over legislation concerning taxes, tariffs, other revenue-generating legislation, entitlement programs like Medicare and Social Security, etc. The Constitution requires that all taxation and appropriations bills must originate in the House. House rules require that all tax bills must first be addressed by the House Ways and Means Committee. House and Senate Appropriations Committees have responsibility for drafting federal spending bills. The House and Senate Budget Committees are tasked with creating an overall budget plan that guides tax and appropriations work. The House Rules Committee develops rules for floor debates, amendments, and voting procedures for all House bills. All House bills must be addressed by the Rules Committee before reaching the floor for debate and a vote. Committees help Congress address complex issues. To do that, committee members need assistance to understand these complex issues and make well-informed decisions. That congressional assistance is provided in several ways. The Congressional Budget Office that provides cost estimates of bills, estimates of how federal mandates will impact states and local governments, and provide forecast data and trends. The Government Accountability Office is an independent, nonpartisan agency that advises Congress and the executive branch on efficient and effective ways to use federal resources. The Congressional Research Service conducts nonpartisan research on legislative issues. The Medicare Payment Advisory Commission is an independent office that advises Congress on Medicare issues. Another essential source of assistance and influence for Senate and House members, committees, and subcommittees is the work of staff members. Staff members are tasked with gathering and analyzing data, compiling reports and summaries, and briefing members on these complex issues and potential legislative solutions. With that reality in mind, it is a wise advocacy strategy to plan for regularly engaging with the Senate and House members' office, committee, and subcommittee staffs. These staff members have significant influence on the public health and healthcare policy decisions of committees and subcommittees. Let's now consider a few key United States environmental regulatory agencies. The Environmental Protection Agency, EPA, the National Institute for Occupational Safety and Health, NIOSH, the Agency for Toxic Substances and Disease Registry, ATSDR, and the National Institute of Environmental Health Sciences, NIEHS. The Environmental Protection Agency, EPA, was established in 1970 with the mission to protect human health and the environment and ensure that Americans have clean air, land, and water. To accomplish this mission, the EPA develops and enforces regulations, including assuring that contaminated lands and toxic sites are cleaned up and revitalized by responsible parties. The EPA also provides grants, studies environmental issues, sponsors partnerships, provides environmental education and publications. The EPA is also tasked with testing marketplace chemicals for safety. The National Institute for Occupational Safety and Health, NIOSH, has a mandate to assure that every man and woman in the United States has safe and healthful working conditions, therefore preserving the nation's human workforce. The Occupational Safety and Health Act of 1970 created both the U.S. Department of Labor's Occupational Safety and Health Administration, OSHA, and the CDC's National Institute for Occupational Safety and Health, NIOSH. Whereas OSHA has the responsibility of developing and enforcing workplace safety and health regulations, NIOSH was formed to provide occupational safety and health research to inform workplace safety and health. NIOSH not only conducts research, but also develops guidance and recommendations on workplace safety, disseminates information, and upon request, conducts workplace health hazard evaluations. In addition to its own research, NIOSH sponsors research and training through extramural programs and enters cooperative agreements with state health departments, academia, unions, and non-governmental organizations to participate in collaborative surveillance and research projects. The National Center for Environmental Health includes the Agency for Toxic Substances and Disease Registry, ATSDR, an agency charged with conducting public health assessments of waste sites, conducting health surveillance, and administering registries related to toxic substances, and providing information, education, and training concerning hazardous substances. The 2022 ATSDR lists 275 substances on their toxic substance priority list. The top 3 toxic substances were arsenic, lead, and mercury. The National Institute of Environmental Health Sciences, NIEHS, is one of 27 institutes and centers of the National Institutes of Health, NIH. The mission of the NIEHS is to reduce the burden of human illness and disability by understanding how the environment influences the development and progression of human disease. The National Toxicology Program, NTP, is located in the NIEHS. The NTP tests and evaluates agents in the environment that may affect human health, including effects of cell phone radiation, developing new approaches to screen chemicals, studies of individual toxic sensitivity, etc. This slide lists major United States environmental health laws. The 1969 National Environmental Policy Act established a broad national framework for protection of the environment. The 1970 Clean Air Act regulates air emissions from stationary and mobile sources. The 1970 Occupational Safety and Health Act assures that employers provide workers a place of employment free from recognized hazards to safety and health. This act created the National Institute for Occupational Safety and Health, NIOSH, located within the Centers for Disease Control and Prevention, CDC. The 1972 and 1977 Clean Water Act and amendments amended the 1948 Federal Water Pollution Control Act to regulate pollutant discharges, gave EPA authority to implement wastewater standards, set water quality standards for surface waters, and funded, through grants, the construction of sewage treatment plants. The 1973 Endangered Species Act provides a program for the conservation of threatened and endangered plants, animals, and habitats in which they are found. The 1974 Safe Drinking Water Act protects the quality of drinking water. The 1976 Toxic Substances Control Act provides EPA with the authority to regulate chemical substances and mixtures, excluding food, drugs, cosmetics, and pesticides. The 1976 Resource Conservation and Recovery Act provides EPA with the authority to control hazardous waste from the cradle to the grave. The 1980 Comprehensive Environmental Response, Compensation, and Liability Act provides a superfund to clean up uncontrolled or abandoned hazardous sites. The 1996 Federal Insecticide, Fungicide, and Rodenticide Act established regulation of pesticides by the EPA. In summary, politics occasionally conflicts with environmental science, resulting in policies not justified scientifically. Public policy problems are not addressed only through government interventions. Advocacy actively promotes a cause or principle involving actions that will lead to a goal. In democracies, advocate groups are an indispensable part of the policy-making process, providing a voice for the public. A wise advocacy strategy is to plan for regularly engaging with the staffs of Senate and House members and committees.